guys, welcome back to Meds Made Easy. My name is Tarun Verma with Telfair Specialty Pharmacy. Today, we're going to talk about Tramadol. Tramadol has really gotten popular over the last few years. You may have actually kind of noticed it in the news as well. It's kind of a byproduct of like the opioid crisis going on. So, I'll kind of get into a little bit of history. Hydrocodones became scheduled out as a narcotic, a C2. Which is why they have to put them on that triplicate. I'm talking about Texas, I don't know about every other state, but point is a lot of doctors are now kind of getting deterred from writing hydrocodones, oxycodones, things like that, again, due to the opioid epidemic. So they're kind of dispensing Tramadol, or they're writing for Tramadol, which is a control, but it's not a narcotic. The difference being it's not as potent, it's not as life-threatening, it's not as overall dangerous as hydrocodone and oxycodone can be if taken in large amounts. Not to say that this is still not a very dangerous drug, it still is, but the risk factor is just a lot less than hydrocodone is. And so let's get into it. It's for pain, pain of anything, cancer pain, surgery pain, etc., etc., etc. It's just a really great substitute for hydrocodone. If oxycodone's up here in terms of potency and effectiveness, then hydrocodone's here, and then tramadol's like down here. So it works a lot better. I won't go over dosing schedules just because depending on what you're taking it for, the dosing could be, you're taking 3 pills a day to like 20 pills a day. It's just dosed out so differently depending on what you have. Can you OD on it? Yes, you can, which is why it's very important. Make sure that your doctor knows about your entire medical history before they're dispensing this stuff, because it is dangerous. You can't have kids stumble into this stuff because they will get into trouble. I'll talk about that a little bit later. Other than that, but in terms of actually taking the medication, it's actually very benign. You can not benign, it's easy to take. You can take it with or without food. You just take it with a glass of water whenever you need. Usually kicks in about an hour. If you're on the extended releases, it takes a little bit longer to kick in and lasts a little bit longer, but it's generally a very short-acting drug. It'll kick in an hour, and I think it reaches its peak concentration, if I'm not mistaken, at around 3 hours, and then it'll kind of wean off. So most people tend to take it every, I think, 6 hours, I believe it is, every 4 to 6 hours, depending on what your dosing schedule is. For any women that are pregnant, you really should not take this drug. Again, I have to defer this to the doctors, but there are instances of like neonatal withdrawal syndrome because Tramadol can cross the placenta and get into the baby, all of that is scary and it can be very life-threatening. So again, talk to your doctor, but usually you do not take Tramadol if you are expecting. You generally don't worry about it if you have hepatic issues, liver issues, or renal issues. Again, it's kind of good in that respect. You don't need to tweak the dosages. It does have a black box warning. Respiratory depression, meaning if you take too much, it'll slow down your breathing to the point where it causes problems. And of course, addiction. So addiction is very complicated in terms of how it works. This drug, back in the day, never really had that connotation of being an addiction potential medication really to it, because that's what hydrocodone and oxycodones did. But now in practice, we are starting to see people that are addicted to Tramadol. And I think a lot of that has to do with addictive personalities rather than the actual mechanism of addiction. People that are addicted are going to be addicted to anything, right? If you take them off of one drug, you may have heard about like Suboxone, same thing. A lot of people that are going through withdrawal symptoms and are in rehab from hydrocodone and opioids, they'll get on Suboxone, and then they get hooked on Suboxone too, which is a medication to help wean you off of hydrocodone. Then you get addicted to the next thing. And so Tramadol, we're kind of starting to see that. It's not, I would say, huge and so prevalent yet, but yes, it can cause addiction, and a lot of that has to do with the individual that we're talking about. So if you do have that kind of addictive personality, you do get addicted to pills, then you could very well see that problem here as well. Again, you don't want to take more than you need to. You should only take it as per how much your doctor needs you to take it. And make sure your kids don't get into this stuff, because this is very, very difficult, especially for developing children. If they get their hands on this stuff, start taking it, it really stunts a lot of growth. It causes a lot of like issues in terms of the respiratory depression that I was talking about earlier. But other than that, it's for pain purposes. If you're just taking it for a couple of days because you just had oral surgery or leg surgery, whatever, pretty good pain option. It does a really good job. and as long as you're kind of weary about that, then it's good. Now, you generally don't get woozy as well, but that's also a maybe, because that also depends on everyone and your own body types. But generally, you don't get drowsy, you don't get groggy, you usually can drive on this stuff, but it depends on your body. Take it, see how you feel at night, and then if you feel like you know that you can drive because it's not causing any sort of haziness, then you're okay to do it. But it always kind of comes with that caveat because everyone's body's so different. Guys, I think that's about it. Again, we try to make these as quick and easy, as simplified as possible. If you have any questions, concerns about the medication, leave it down below in the comments. Otherwise, thanks for tuning in. Subscribe to the channel. We're going to keep coming out with more content on a lot of other drugs coming out. Guys, this is Meds Made Easy. We'll see you next time. Bye.